72? Thanks. Do you think nursing is only about caring for people in the hospital? If you do, please stay tuned. Tonight on Forum 16, we'll introduce you to several area nurses who are helping to shape the future of healthcare by practicing their profession in a variety of settings.
Addressing issues, places, and events that affect southeastern Illinois, this is Forum 16.
Welcome to Forum 16. I'm Bea Cessna. The week of May 4th has been designated as National Nurses Week. The 2 million registered nurses in the country represent our nation's largest healthcare resource. In Richland County alone, there are over 200 nurses who work in various facilities providing a wide range of healthcare services. National Nurses Week has chosen for its slogan, Shaping the Future of Healthcare. And this week is a celebration of the ways in which nurses strive to provide high-quality patient care and improve the nation's healthcare system. The nursing profession has a rich tradition in Richland County. Nursing education began in this area in 1907 with a school located at the Olney Sanitarium. Today, the Illinois Eastern Community College District continues to provide our area with highly trained healthcare professionals. Education has always been the first step to becoming a nurse. Therefore, to begin our celebration of Nurses Week, let's meet our first two nurses, one who trained at the Olney Sanitarium and one who is involved with nursing education today.
Nursing started in the United States back in 1872, and there were 5 schools of nursing at that time, and only about 20 girls were in the schools. The Olney Sanitarium School of Nurses were one of the first nursing schools in southern Illinois, and they opened up in 1907. Miss Catherine Weber, a sister to Dr. George Weber, who established the Olney Sanitarium Hospital, was the one who developed this school of nursing. A very remarkable nurse and one who was very capable of keeping it going. And during the period of 1907 to 1949, we had approximately 295 nurses graduate from that school. And I'm happy to say that I was one of them who graduated in 1946, which was during the war. And at that time we had less nurses because a lot of the young ladies were in the services. We had only 3 doctors at the time that I entered training, but I think our training was probably super during that period of time. Miss Minnie Weber was also involved as the director or superintendent of nurses at that time, and she was a sister to Miss Catherine Weber. The school provided opportunities here in rural America for young women to get into a profession which we were very proud of at that time, and I think we can continue to be very proud of. I was asked to compare a little bit about nursing education then versus today. Of course, we live in a free world, and our professionalism was looked upon entirely different. And I shared this information with some friends, saying that I can recall very well we never went to breakfast without being properly dressed in our uniforms and were inspected before we were allowed to go on a nursing unit and see a patient or to be seen by, work with the doctors in an outpatient services. And I don't really think that hurt us to go through those realms, and they did expect for us to have a very professional appearance as well as an attitude when we were with our patients. As far as changes taking place during the World War II, when I was in training, we were not allowed to start IVs. To give you an example, in fact, patients who were admitted that had to have blood was very, very critical, and we really didn't expect those people to live. Where today, this is a common way of treating our patients, and we can certainly be happy that our technology has improved to the amount that we have a lot better results from our care that we give. I also think that the progress that has been made in the healthcare and in the nursing profession has given us the quality of people that we need in our high-tech care that we have today. We wouldn't have been able to accomplish that if we haven't gone ahead and grown with it.
tell you a little bit about how the students in nursing learn today, how their education is structured. When they're learning skills such as starting IVs or giving injections or any of the skills that a nurse must do, first of all, they study the content. They study the theory and back of it. Then they hear a lecture on it. They have a demonstration. They go to the lab, practice the skill, and come back at a specified time and give a return demonstration to their instructor. At this point, they go into the clinical agencies in the hospitals and nursing homes, and they perform this skill with a live patient under the supervision of a nursing faculty. This is quite different than the diploma program, where the student was actually taking care of patients on a regular 40-hour-a-week shift. To learn the theory of nursing, many modes are used, such as lecture, video, computer programs, and hands-on in the laboratory setting. One of the important advantages with the associate degree program is the flexibility in going on for advanced degrees. The graduate from the associate degree program has the first 2 years of the baccalaureate program and can move easily into the baccalaureate schools of nursing. After that, they can go for a master's degree and even a doctoral degree. 4 of our faculty here at Olney Central College got their basic associate degrees from Olney Central College and went on for higher degrees and are now teaching with us. A couple of our faculty have specialty degrees. A pediatric nurse practitioner and a trauma nurse specialist are on our staff. Through the expanded roles of nursing and those nurses who choose to stay at the bedside care, I believe that we can and will shape the future of health care.
The demand for nursing services is greater now than ever before. An aging America, the health industry's ability to sustain life through increased technology, changes in the settings where healthcare is delivered, changes in healthcare financing, and the changing healthcare needs of today's consumers. Today's nurse is a part of our healthcare from cradle to the grave.
When we talk about obstetrical nursing, I just don't think there's a better career choice any nurse can make if she has to sit down and decide which area of nursing she wants to make her lifetime career. Obstetrical nursing for me has just been a joy. I feel like I have been enlightened by all the people that come through our doors, and that what we can do is take the most serious and critical time in their life, such as giving birth to maybe their first child or their second or third or whichever it may be for them, and make it the most rewarding experience and one of the happiest times that they'll ever have until the day that they die. Basically, for me, obstetrical nursing gives you the best of every possible world. You can actually take care of the highly critical patient using your high-tech nursing, such as your cardiac monitoring of the mother, fetal monitoring of the fetus, and giving all the highly sensitive drugs that are needed to stop preterm labor or perhaps to augment the labor experience itself. And then you have to shift gears and actually think about going into the newborn nursery and taking care of the babies. Taking care of a nursery full of newborn babies that are healthy, and you see the tears of joy in the daddy's eyes, and you see exactly the rewarding experiences that the mothers and fathers have when they bring their other children in to actually learn how to cope with this new infant in their lives. You have the responsibility as an obstetrical nurse to make sure that they get off on the right foot and that there are no ill feelings of anyone with this new family concept, that the other children in the family feel just as important and needed as the newborn baby is themselves. And then we have to shift gears again and think about, what if we happen to have a 2-pound premature baby born in this hospital? We're a level 2 nursery here, and we are expected to have the capabilities, the knowledge, and the skills to go into the level 2 nursery and work with this little 2-pound baby and make sure that it has the highest quality of care and the best possible start in life that it is going to have, considering that it might be 2 to 3 months early.
I love what I do. psychiatric nursing is a fascinating and a challenging specialty area. On our unit, the nursing staff does the first assessment of the patient when they come onto the unit. We do the initial treatment plan, and through the patient's stay, we monitor their progress, and then with the patient, we evaluate treatment goals and how they're being met. We don't use usually a lot of high-tech equipment on our unit, but we do use a lot of interpersonal skills. We talk a lot. We do a lot of patient education. We facilitate groups. We participate in a lot of different activities with patients. And we also work closely with the rest of the treatment team, our psychiatrists, other medical doctors, the social worker, the psychotherapist, the activity therapist. It's really important for us all to work together to provide the quality of patient care that we try to provide. I really learned a lot working in this area and about life, and I've gained a lot from our patients, more than I really could ever return. I think probably I enjoy working in this unit most because I'm really proud to work here. I really enjoy working with the rest of the staff. We like what we're doing, and I think most of all, I really love our patients.
Nurses up here are trained in geriatric nursing. They learn all the differences with the elderly compared to the young people. There's a lot of differences in care that you do with them. And this has been a very big challenge for the nurses here. With the influx of the elderly in the next few years, units like this will probably be needed more and more. And the acute care beds will be used for those patients that are very, very ill, and the long-term care beds or skilled beds will be used for those patients that need more time before they can go home. You get to know the families very well since they're here for a long length of time, and that's probably one of the biggest pluses that we have, that we can talk with the families, we learn about their life, we learn about their homes. With the patient, we get to know them very intimately, and they're more than just a patient anymore. Then they're a part of the family, and we are just really happy when they get to go home, and that really makes everything up here worth working in this unit.
We encounter nurses throughout our lives. A nurse helps bring us into the world, can help guide us through troubled times, and make our old age more comfortable. In our day-to-day lives, nurses play a role also. School nurses focus on the prevention of illness and disability and on the early detection and correction of health problems. Public health nurses work with people who might otherwise not receive health care. On the front line in the battle against disease, these nurses provide immunizations and education. In the workplace, nurses provide immediate attention to the victims of industrial accidents and serve as an access point for workers into the healthcare system. At long-term care facilities, nurses provide a wide range of care to the residents. In the clinical setting, nurses fill several roles, from working with children or removing a cast to working with patients who need specialized treatments such as chemotherapy. Some in the nursing profession prefer to work in a more technical area. Healthcare today is changing rapidly as medical technology increases. The ability to prolong life and to save lives has created a niche for those who wish to work at the cutting edge of healthcare.
The role of the ICU nurse in this hospital requires a lot of responsibility from the nurse. She has to be able to manage on her own. She has to take responsibility for patients, for equipment, for families, and she has to be able to solve her own problems and be able to pick up the telephone and call somebody else to solve them for her. This job requires a lot more education, requires more training, not only with patient care, but with sophisticated equipment and changing technology and situations. The nurse in here works with the critically ill patients, and this is a very demanding and challenging role, and I think that's probably what I enjoy the most about it, is the challenge. Things are never the same in here. The census is not stable. The situations are changing each and every day. You don't know what you're going to come into, and you have to be able to think quickly, to be able to organize, set your priorities, and carry out your duties in a calm manner. We see a variation of illnesses in this unit, both medical and surgical. We see a variation of ages. So there's not a lot of stagnation up here. And this area of nursing is for the nurse that wants to be able to meet these challenges and to have changes and to apply herself and learn.
Probably the most interesting aspect of being an emergency room nurse is the variety of patients you see. Emergency room nursing is not for everyone. You have to be a very flexible person. You have to be willing to come in and not have an assignment, not know what faces you for the next 8 to 12 hours, and be able to handle whatever walks through that door. It may be perfectly quiet one moment, and 15 minutes later you may have 10 patients on board to take care of. We see many things from minor medical to major medical, from minor trauma to major trauma. We don't get to spend the time with our patients and families that the nurses on the floor do, but we spend very quality time when they're down here. We try very hard to keep families informed of what's going on, the condition of their loved one. Patients that are discharged from the emergency room all have to have very complete discharge instructions given, so there's a lot of education that goes along with emergency room nursing. Many of the patients are admitted to the hospital, and the nurse accompanies them to the floor and gives a full report of their condition and what was done in the E-room. So there's a smooth transition period from being in the emergency room to being a patient up on the hospital floor. Very critical patients who require care that's not available here at RMH have to be transferred to larger centers, and those transfers are usually made via ambulance or a helicopter. Those times are very, very hectic, getting the patient stabilized and getting all the arrangements made to transfer the patient. Continuing education is a very important part of emergency room nursing. All our nurses are advanced cardiac life support certified, and our director, Dr. Rodriguez, gives us monthly in-services on trauma, so we stay up on trauma nursing also.
As we as a population age, our healthcare needs change. Nurses fill vital roles in helping us recover from illness and in the management of conditions that may persist for the rest of our lives. Changes in the financing of healthcare and the changing healthcare needs of today's consumers have changed the methods in which some healthcare services are delivered. But today's nurses are filling roles that cater to this new climate. Two such areas are hospice and home health programs.
You've been looking at a lot of the duties that RNs perform in the healthcare field. I would like to introduce you to the aspects of being a hospice nurse. Our primary function is to take care of terminally ill patients, and that involves both taking care of the patient and also being a resource person and a support person to the family. Our team is composed of physicians, medical social workers, and other people involved in the healthcare field, and nurses play a very vital role in that team. We cover an entire gamut of taking care of folks that are in the geriatric age, as well as newborns or pediatrics. So we have to have expertise in a lot of fields, and our primary thing is that we work with all the other special disciplines so that we are able to give complete care to this patient and family.
In home health, we do primary nursing care. It's really rewarding because you are the primary nurse for the patient. It's your responsibility to see that the patient receives the care that they need, that you call the doctor when it's needed, and you are the one who is responsible. Of course, we always have the other nurses that we can confer with and discuss the patient to see if there's something that we're not sure about. but you are the responsible nurse, and it is very rewarding. You get very close with the patients. They get close with you. They get to where you are their nurse, and you are the one they want to come out and see them. They don't want some other nurse to come out and see them. You get very close with the people.
Hopefully by now you can see that the nurse's role in delivering health care has expanded to meet the needs of the health consumer. Hospitals are placing nurses in positions of responsibility where health care costs can be reduced, such as same-day surgery units. Nurses fill administrative positions and are critical to day-to-day operation of hospitals. So what does the future hold for the nursing profession? Nurses will take on an expanded role in delivering health services, especially in rural areas. Through further training and under the direction of doctors, these nurses will be providing services once only delivered by doctors. 3 such areas are nurse midwives, nurse practitioners, and the nurse anesthetist.
Nurse midwives provide care for women during their pregnancies, help them through labor and delivery, provide emotional support, and do the actual delivery, normal spontaneous deliveries, and then provide the postpartum care, help them with normal gynecologic care throughout the course of their life if people choose to go to a nurse midwife. When an expectant mother decides to go to a nurse midwife, she's made a first decision of who she wants for a health care provider, which nurses are able to provide, and be able to provide care along the continuum. Being a nurse midwife, you're able to see the patient maybe before they become pregnant, follow them through the pregnancy, be able to provide the support that they need during labor and delivery, help to incorporate the baby into the family, and let them adjust to the baby, help them make the decisions that they need to make during the course of being pregnant and throughout their life, and how to care for the baby and best way to feed it, and just answer questions that they might have. Nurse midwifery has finally become an accepted element in health care that's available to people, women, families. Nurse midwives don't have the patient load that an obstetrician has, so they're able to spend more time talking and counseling with the patients, answering their questions, providing them more information so they can make an informed consent, to allow them to have to be able to make the decision of their own health care. They've got enough information that they can make their own decisions, and nurse midwives try to help the patient keep what autonomy that they can have.
Nurse practitioners are RNs that have additional training, especially in assessment skills, knowing the difference between normal and abnormal, and we are used as a screening tool to rule out any abnormal problems, and then we refer to our physicians that have the expertise and the knowledge to treat further. Also, nurse practitioners can treat chronic illnesses, including diabetes or hypertension. I'm one of the first nurse practitioners being utilized in the Olney area, and I've been used as a screening tool, or I'm the screening tool. People have access to me and refer then on to cardiac or surgery or pediatrics. What we are doing as a new breed, quote unquote, is freeing up our physicians to see the more severe illnesses and using their additional training. They've been to school for many, many years and to treat, whereas we are treating
minor illnesses and screening.
I'm a certified registered nurse anesthetist. I went into anesthesia because I enjoy the challenge. It's very intellectually stimulating. I enjoy helping people and rendering them insensitive to pain. That's the object of anesthesia. To become a nurse anesthetist, you have to be a graduate from an accredited program. You have to have a Bachelor of Science degree in nursing. And from then you go into anesthesia, which is a minimum of a 24-month program. And if you want to get out with a master's degree, it's up to 30 months. Prior to going into anesthesia school, you usually have to have 1 year intensive nursing, such as intensive care unit, or working in the emergency room, or working in the operating room. My care begins with a pre-op visit. That's when we walk up to the patient's room and we talk to them about their anesthesia. Each anesthetic is tailor-made depending on the type of procedure that's to be done, the patient's physical status. Some patients we put to sleep, that's called general anesthesia. Other types of anesthesia are regional anesthesia. We give spinal blocks, saddle blocks. We do axillary blocks to make an extremity such as an arm numb. The object is to make the patient as comfortable as possible for the procedure. Some procedures the patient doesn't go to sleep at all, and all we give is some sedation and some comfort. If anyone is interested in going into anesthesia, you have to have an inquisitive mind. You have to have a science background. And I would say you have to have a certain type of personality. It's certainly not for everyone. It's a very demanding job, both physically and intellectually. I find it very satisfying, and I wouldn't choose to do anything else.
Throughout your life, you will need health care, and more than likely a large portion of that care will be provided by a nurse. Throughout this program, we have tried to let the nurses speak for themselves. We at Forum 16 would like to thank these healthcare professionals for sharing with us who they are and what they do. To close our program, we turn now to Lila Burrows, Director of Nursing at Richland Memorial Hospital.
Nursing is an important part of healthcare in our community, and nursing encompasses the physical, the psychological, the social, the cultural, and the spiritual aspects of healthcare. In nursing, we have a lot of opportunities and challenges to make a difference. As you've seen, nursing encompasses the various settings, the healthcare delivery within the acute care settings within the hospital, within the community, the long-term, the public health, the schools of nursing, nursing education, the crippled children. Nursing encompasses a variety of settings, the industrial, so that nursing has a great impact upon the health care in our communities. Our healthcare environment is changing, and the demand for nurses is even greater. It's predicted that within the next decade, there will be a need for an additional 600,000 nurses to service our communities. It takes a special person to be a nurse. Through knowledge, skill, and a caring attitude, the nurse will be shaping the future of healthcare in our communities. Nurses are highly skilled and creative, and she uses these skills on behalf of the patients, the physicians, the family members in carrying out her responsibilities. It takes a special person to be a nurse. Yes, nurses are special people.